Are you addicted to porn? Do you feel it's hard to resist the compulsion to watch pornography? Do you feel you're at risk or your loved one is at risk of having a problem that's causing disruption in their life due to pornography? If so, you're here at the right place. My name is Dr. Andrew Kim. I'm a board certified psychiatrist, and hopefully, we're going to give you a nice, broad overview of talking about this phenomenon of pornography addiction. Now, I want to give you a fair disclaimer. We are going to be talking about pornography. We're going to be talking about sexuality, sexual issues. So, if this is not something you want to hear, I advise that you log off right now. So, I gave you fair warning, everybody, but this is a very serious topic, and I want you to know that this is a judgment free zone. If you are here, more than likely, you have typed or searched in the YouTube algorithm, do I have a porn addiction? Do I have a problem with pornography? Am I addicted? And I know that this issue is a very isolating issue. There's still so much taboo, there's so much stigma, there's so much judgment in society, and that leads to shame, guilt, embarrassment to want to even learn about this, talk about this, seek help for this, be open about this. Okay, so this is a judgment free video. I want this to be educational, to raise awareness, and help you try to discern if you think that there is a problem or you may be developing a problem. Okay, so first of all, I think it's important to recognize that this terminology, pornography addiction, right, is not officially something that is in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, the classification guide of mental health disorders that are used by psychologists, therapists. So it's not actually an official diagnosis. Okay. And there's still controversy of whether porn addiction should be labeled as an addiction versus a compulsive or behavioral disorder, versus even being listed as a problem as all. Now, I will say personally, this is my personal opinion, having practiced as a psychiatrist for 13 years, I do think it should be listed as some type of disorder because at a certain point, when it becomes persistent and pervasive and excessive as a problem causing disruption in various domains of your life, I do think it meets the threshold of potentially becoming a disorder. Whether you want to call it an addiction versus a compulsive disorder, that's semantics, but I think it's really more about the recognition that it can be problematic and disruptive. Okay. I hear about this all the time, every day, every week in my psychiatric practice. Okay. I've been practicing for 13 years and it is a problem. Trust me. It is likely underreported because of the shame and the guilt and the embarrassment involved. Now, what are some of the factors of why I believe that this is such a prevalent and widespread problem? I think number one, accessibility and availability. Back in the day, okay, I mean, I'm 42. Back in the day, to access pornography, I mean, you really had to go out of your way. I mean, you'd have to go to the kind of back adult section, right, with the walk of shame past other customers and employees at a video store to look at the adult videos, right? Or maybe a standalone adult store and hope that no one's watching you park there and go in. Or, going to like a gas station or something and picking up a Playboy or a Hustler, whatever it might be, purchasing something on pay-per-view. And then if you're not single and living alone, figuring out how to hide credit card charges on the cable bill, right? But with the advent of the internet, mobile phones, literally access to adult material and pornography, instant. Your fingertips, it's literally on a mobile phone sitting in your pocket, right? Not only that, not only for those who are not even purposely, intentionally searching for pornography, we are bombarded by sexuality and sexual content nonstop. Banner ads, commercials, pop-up ads on social media, whether it's literally for an explicit porn site, OnlyFans, et cetera, et cetera, et cetera, right? Viagra commercials, right? It's everywhere. So it's no surprise to me that this is a problem, the instant access and just how pervasive and woven this is into our society. I believe there's a component of escapism and coping. We are human beings. Sex is a part of our health and well being. Sexuality in itself is not unhealthy, but sexuality, when over relied on as a means of escape and coping, can become problematic, right? But we are pain averse, we are hedonistic and pleasure seeking, and watching porn, finding release, may end up being an overutilized coping mechanism, right? To deal with problems in our life, to find temporary relief from negative emotions, feeling overwhelmed, whatever it may be. And then that spills over into conditioning. The brain's reward system and conditioning plays a role in addiction or compulsion, right? I do believe there is a release of dopamine or a reward mechanism when watching pornography, getting excited, whether you decide to then masturbate and then get that reinforcing effect as well. There is a behavioral component, there's escapism, there's coping, and there's the instant availability. These are some of the factors. I know this wasn't comprehensive, but that's why it's so widespread as a problem, in my opinion. Now, let's talk about the the warning signs and symptoms that you either have a problem or are at risk of developing a problem with pornography. Let's start with behavioral signs. These are some of the behavioral signs. And when you listen carefully, some of these are going to sound very familiar to the warning signs of classic addictions. Number one, spending an excessive amount of time consuming pornography or thinking about when you're going to get to watch the pornography again, oftentimes to the detriment of other responsibilities, duties, obligations, your social life, your work life, academic life, which can then get deprioritized. Failed attempts to cut down on the usage of or the watching of pornography. Escalation with desensitization. And what I mean by that is it's very common for me as a psychiatrist to hear from patients who are struggling with this, that they'll tell me after a certain point, it's almost like a tolerance has built up, right? And the novelty has worn off. And they'll say, I used to watch this standard one-on-one, male to female porn. Doesn't cut it for me anymore. The regular stuff just doesn't cut it for me. I'm not getting excited. I'm not getting aroused. It's not satisfying. And they'll kind of describe to me an escalating behavior. I'm watching more and more niche kind of stuff, more intense kind of stuff, maybe fringe stuff I shouldn't be watching. And it is escalating, right? So desensitization, escalation. There may actually even be real world escalation in problematic behavior. So, not just about what kind of content you're watching, but now I'm engaging in very risky behaviors. I might be watching pornography in public, at the workplace, around other people, in inappropriate settings. I might be masturbating compulsively in public settings, in a public bathroom, etc. I might be engaging in risky behaviors, seeking out sex workers, because now just watching pornography isn't cutting it. I'm now bringing it into the real world to now try to replicate that with physical intimacy for more satisfying fulfillment. So these are some of the warning signs behaviorally that you have a problem or you might be developing a problem. What are some of the emotional warning signs? Feelings of guilt, shame, embarrassment associated with watching the porn itself. Sometimes then going right back to using porn to then cope with those feelings. Persistent cravings and urges, almost like a substance, persistent cravings and urges to watch pornography. And then maybe even developing irritability and edginess and mood swings when you're not able to scratch that itch and watch it instantly or watch it right on the spot. Or you might notice these mood swings and irritability when you're trying to reduce or cut back on the use. Does that sound familiar? Again, very familiar with what we hear about in classic addictions, right? There may be diminished interest in passions and other activities and other relationships that are important to you. Now, beyond some of these behavioral and emotional signs. There may actually even be physical signs and warning signs. There could be fatigue, grappling with, I want to stop, I want to watch it, I want to stop, I want to watch it, can be exhausting, honestly. There can be sleep disturbances from staying up too late, watching this too often, without, not being facetious, even eye strain from too much screen time. There can literally be erectile dysfunction because of that escalation desensitization problem. Because now, even situations that don't involve porn aren't exciting to you anymore. And you literally might even develop erectile dysfunction in scenarios. So, these are, I know it's not comprehensive, but these are some of the warning signs that a problem may be happening. Now, let's talk about some of the potential fallout and consequences if this problem becomes pervasive and persistent and is not addressed. I think one of the biggest things that we need to talk about, the elephant in the room, is the potential impact on relationships. Just like with other compulsions and addictions, it may not just affect the individual struggling with the behavior, but their loved ones and the people in their lives and their inner circles. So when it comes to relationships, obviously this in itself can cause problems with intimacy, right? You may actually have developed now a decreased sexual desire towards your actual real world partner. There might be difficulty achieving or maintaining arousal towards your partner. You may develop performance anxiety because of now this skewed view of what sexual intimacy should look like. And now you have these unrealistic fantasy expectations of how I even have to perform, and it may lead to performance anxiety. You may end up getting dissatisfied with sexual experiences in real life. You may get dissatisfied with your partner. Why aren't they performing what I see being performed in porn? What I get excited by? You may actually start having a preference for pornography over actual physical intimacy. You might even become increasingly demanding of your partner to perform sexual acts they aren't even comfortable with. There can be so many different variations of impact on intimacy itself with your loved one. There may be a fallout or problem with communication. Trust and honesty itself is going to be jeopardized and challenged. There may be a flat out avoidance of discussing the issue at hand, not even acknowledging there's a problem, defensiveness, flat out denial that there's an issue that you're developing or having, and inability to express these because of the shame and the guilt and the judgment that may be involved, increased conflict and arguments. Trust, the cornerstone, right? Not to sound cliche, but trust is the cornerstone of healthy relationships. And that, at the core of it, is going to be threatened because of all of the above, right? And obviously, when trust is threatened, there can be a feeling of betrayal. Seeds of doubt become sowed, and doubt becomes rampant in the relationship. Suspicion occurs. There may be a sense that one partner is living a double life, becoming totally withdrawn, emotionally distancing themselves, and it may be so challenging to then repair and rebuild that trust. So there can be so many things that can impact the relationship itself. This is a threat. This is an enemy of a healthy relationship. There could be psychological fallout, right? We already touched on it a little bit, but just to really emphasize, right? This problem is a very isolating problem. It makes you feel like you're in this alone. You're in the dark. There's no one you could talk to. Guilt and shame, I can't emphasize it enough. That is what is a common thread with everyone I work with this problem. The guilt and shame can become so consuming and so isolating, right? Internally, right, the excessive consumption of porn can lead to internal conflicts. And it could be a variety of things, right? There could be a conflict with your value system and your morals. There can be a conflict of just how you view yourself when it comes to your self view and your self confidence. Why can't I overcome this? Why am I so weak? Am I weak in character? Am I weak in strength? how come I can't overcome this, right? This is a breeding ground for remorse and self-hatred and self-condemnation. And, oh, I mean, it takes such a toll on your self-esteem and your overall well-being. So definitely there is an impact on the psyche and the view of self. There's also a psychological risk with distorted views of sexuality. So I know we already talked about like what can happen with intimacy, but I'm saying even internally with the individual themselves, just a psychological shifting that can become dangerous, right? There can be a skewed and unhealthy and an unrealistic view of what healthy, intimate connection should look like, what sexual satisfaction should feel like, what real life sexual encounter should look like. And where it can get really dangerous, and I mean it, guys, right? Like not to sound cliche, just reading things off of some kind of blog or wellness blog about porn addiction. It's where it gets very dicey is that you can get a psychological skewing of the perception on the concepts of consent itself, consent, safe boundaries, safe sexual practices, healthy sexual practices. Again, it's not even just about you. This becomes dicey for those in your lives, right? What if you have an unhealthy or dangerously skewed view about consent and boundaries? That distortion can become dicey and dangerous. Let's just say it. Okay. So, a distorted view of sexuality, kind of the impact on the view of yourself and your psyche. And yes, I believe it can also become a risk factor for your mental health. Okay. If unchecked, if causing so much distress and disturbances in your life, this can be a risk factor, in my opinion, for worsening depression, anxiety, insomnia, other kind of compulsive, obsessive behaviors. Maybe it feeds into other addictive behaviors, substance use, etc., or vice versa, right? This could be an end manifestation of all those things. And this can become this self-perpetuating feedback loop, right? So for all of these reasons, right, there are clearly things that can impact functioning and your health. It can impact your mental health, it can impact your physical well-being, your psyche, your relationships, your social life, your academics, your work. So that's why, right? I'm not coming from this like moralistic high ground, right? Some kind of right-wing Christian stance of, oh, like anyone who watches porn, shame on you. No, no. People watch porn and don't have huge problems in their life. That's reality as well, right? To be fair and balanced. I'm saying that if it gets to this point where it becomes this compulsive and this excessive and this disruptive, that is the definition of how the mental health field defines a disorder. And that's why, going back to the beginning, I do think there is a need to figure out where does this fit in the mental health kind of diagnostic hierarchy in future iterations of diagnostic manuals. It is so prevalent. I see it. It is there. You know it. If you're some of you watching this know you are struggling. Loved ones of yours are struggling. This is a problem that needs more recognition. There has to be more discussion about this. We need to develop, easier access to resources for treatment and how to treat it appropriately. There's not even a consensus on what is the best way to address this. Okay. So to end it, right, I really hope if you made it through to the end and you are watching me now at the end of this video, the main thing I want you to understand is if you are the one who is going through this or your loved one is going through this, it's to recognize, yes, this is challenging because there is so much stigma, there is so much judgment in society from people in your life. There is so much guilt and shame and embarrassment that this is a very isolating issue, a very isolating problem. But the reality is, I know it will take a lot of motivation, a lot of effort, maybe some prodding, maybe some struggles to open the eyes to find that motivation. But the thing I want to end with is this is something that can be overcome. This is something that is treatable, and this is something that can improve. So it is important for you to hear that. Okay. This can become a consuming problem. Okay. And for those of you, I know there will be comments. There's going to be some comments here. Oh my gosh, that's what they're so weak. They're wimps. You should do the hard stuff, struggle with the hard stuff, heroin. Okay. Yeah. Okay. You know what? Guys, if you have not struggled with it, if you have not helped treat it for people, you don't know them. This can become that detrimental to your life. I mean, this can really ruin somebody's life and their well-being mentally, physically, emotionally, psychologically, spiritually. It can ruin somebody. So, don't talk on things that you don't know about. All right. Don't judge other people's struggles. That's all I got to say. So I know there's going to be some comments. And that's why I'm imploring those who are struggling with this, tune that out. Tune out the noise of people who say stuff like that. This is a big problem. There is no shame in asking for help. Our field has to do a better job. We have to do a better job of offering the right type of help. But I want to end with that. This is something that could be treated. This is something that could be helped. And I want you to hear that loud and clear. I hope this was helpful. I hope this sheds some light on a topic that people don't want to talk about out loud. And there's no problem that maybe you came here because you searched the terms. Am I addicted to porn? Do I have a problem with porn? Okay. Sometimes it starts with this acknowledgement, acceptance, realizing there's an issue, and you start from there. You start one step at a time. You take that small step. That's great. That's wonderful. I want you to take one more step after that and seek some professional help if needed. Seek some help from a friend. Seek some help from a partner, but seek help because this can be treated. This can be overcome. Thank you for listening. This is Dr. Andrew Kim. Please subscribe, and I'll try to keep putting out more content about some of these serious topics on my evergreen list of videos. Thank you again for joining, and hope you guys are doing well.